As most of the nearly 300 confirmed cases are at hospitals like this one here in Wuhan, ground zero for this mysterious virus. And it's also showing up in other cities as well as Japan, Thailand, and South Korea. The concern, of course, how to stop it from spreading. A Chinese scientist has confirmed that it can be transmitted between people. And in one case, one person infected 14 healthcare workers. So there's a scramble to contain this at what's the busiest time of the year for travel here in China. Literally hundreds of millions of people are on the move for the Lunar New Year. The World Health Organization is holding an emergency meeting to determine whether this outbreak is now an international public health emergency. Guys, back to you.
All right, Janis, thank you.
Let's get more on that. NBC News medical correspondent Dr. Torres is joining us with more on this and how the U.S. is dealing with the risk, which is probably the first question people have. Wait, it sounds right now like it's contained more or less in Asia, but what's the worry here?
And at this point, it's still a public health crisis more than it is any kind of personal or individual type of concern. And the U.S. is doing what they can to try and stop it. We got a lot of lessons from the SARS outbreak in 2002 because everybody waited so long for that and it spread to the U.S. So they're trying to stop that from happening, especially since so many people from the area will be traveling in the next few weeks for the Lunar Chinese New Year.
So they're actually screening passengers who are coming into this country. How contagious is it? Like if I'm sitting next to Savannah, can I get it? Right?
No, you can't. It's contagion now. It transmits human to human, but it has to be close contact. And close contact means you're either living with somebody or caring for somebody, or if somebody is coughing, again, this is that cover up when you cough and sneeze. If they're coughing and the cough droplets get on surfaces and you touch the surface and touch your face, then you could get it that way as well. So it's one of those things. It's not like measles, which can transmit very easily, or the flu. This is one of those ones that you have to be in close contact in order to get it from somebody. And that's one of the things about it right now that's still keeping it at bay.
I mean, you mentioned SARS. You know, more than 800 people died in more than 30 countries back in the early 2000s. How worried should we really be at this point?
We learned a lot of lessons from SARS, and number one was getting it out to the public as soon as we can to let people know and health officials know. Tomorrow, the World Health Organization is having that meeting to determine whether they're going to declare an international emergency. If they do, I think you can see a lot more resources. At this point, I don't think we need to be worried like we were back in the SARS days, but it hopefully doesn't get to that point.
Yeah.